Welcome back, Thrani. I'm Joe B. Say goodbye to a nagging back rib pain through simple joint techniques and exercises to fix a posterior rib. Let's dive in. A posterior rib dysfunction is when the rib is stuck backward or posteriorly as compared to the rest of the ribs. The cause of this can be due to hypermobility of the costovertebral and costotransverse joints or trauma like getting hit at the chest. A posterior rib can bring about a localized dull aching pain on the mid-back, increased by deep breathing. There's also a backward prominence of that dysfunctional rib at the mid-back. The assessment for a backward or posterior rib dysfunction requires the physical therapist to do a posterior rib sweep. Patient is in an erect, relaxed, short sitting position with arms at sides. The therapist will be behind the patient with index and middle fingers located 2 finger breadths lateral to the thoracic spinous processes. The palpating fingers are slowly slid from the upper first rib to the lowermost rib number 12. Normal findings are that the ribs are of normal similar prominence on either side of the thoracic spine. Abnormal findings is that if you have a right posterior fifth rib, then that rib will be prominent backward or posteriorly. For the treatment, a compression of that rib can be done in prone position or a belly lying position with the therapist's pisiform bone reinforced by the non-dominant hand, but may be too aggressive to start. So a muscle energy technique can be done in an effort to push forward the backward rib and reduce the backward displacement. This technique will be much more tolerable for your patient. The patient will be in a short sitting position with the right hand at the left shoulder. The therapist is behind the patient and to the left. The left hand holds the right elbow while the right thumb is lateral to the fifth rib angle. The therapist lifts the elbow to localize the force on the fifth rib, then instructs the patient to move the right elbow to the left shoulder against the therapist's resistance, while the right thumb provides an anteromedial pressure just lateral to the fifth rib angle. The position is held for 6 seconds for 5 reps. For the exercises, using a tennis ball pressed in standing against the wall can be done for 3 reps for 30 seconds each as your patient tolerates. So do you want to know how to correct an antero-posterior rib compression injury? If so, then watch this next video. Thank you so much.